5 predominant reactive species were tested, that is the free radicals, and by a simple numerical value, Jobelyn was found to have higher value than the others when they were compared. And these were compared with other fruits and vegetables. And Jobelyn was known to have up to 37,622 TA value, that is Prolux equivalent value. So we can see the antioxidant property were confirmed by this compound, by this laboratory in the US, to have a very high oral value. And if you go to the next slide, you see the comparison with other, next slide please, comparison with other fruits of its kind. So Jobelyn is not only medicinal, it's also a complete balanced diet. It has carbohydrate, it has caloric value, it has protein, it has dietary fiber and fat. Jobelyn is safe. Next slide. Jobelyn is safe because the toxicological studies done in the College of Medicine, University of Lagos in 2009 showed that the lethal dose 50 value is very, very high. So you can see the lethal dose 50 value that you need to take about 215 milligrams per kg to have toxicity in mice. And this by the oral route and the intraperitoneal route. This shows Jobelyn to be very safe, even in high doses. In a clinical study I did, that is next slide. In the clinical study I did in the Lagos Military Hospital, Ikoyi, I saw 64 persons living with HIV. And I evaluated the efficacy of Jobelyn in enhancing their cellular immunity in 2003. It was found that infected patients had positive, it was seen to have positive cellular immunity on infected patients with HIV. Both those that were on treatment, that is, those that were placed on heart, and those that were not eligible to be placed on heart. 64 patients were seen and studied for the efficacy of Jobelyn to enhance their cellular immunity. These patients were confirmed by Western blot technique then to have HIV-1, and they had baseline investigations that were done on each of them. These patients were divided into 3 groups. The first group were those with CD4 count above 300. At that time, we were using 350 for the national values. Those were placed on only Jobelyn. Those with CD4 below 300 were already placed on heart under the national program, but were added, that is, they had additional Jobelyn to their regime. And those, then among them, there were 2, the other group had only hearts. They were already on the national program, so they continued. The findings were that there was significant increase in elevation of CD4 count in patients, 40 of them that were placed on Jobelyn plus triple antiretroviral therapy when compared to those placed on heart alone, 17. Jobelyn alone significantly increased the CD4 count of patients, 7 of them with initial CD4 count above 300. Patients placed on Jobelyn and heart showed up to 91.4% mean rise after the administration of the drugs. Those placed on Jobelyn alone had an increase of 43%, while those on heart alone had up to 30% increase in CD4 count. Another study at a HIV clinic in a police clinic in Valomo showed that 10 people were tested. Were participated. These 10 were confirmed to have HIV, and their CD4 count was seen to decrease. You can see on this slide. This is just the letter sent from the Valomo clinic to tell us of the increase in CD4 count when they tested them at 0, 4, and 8 weeks. In my own case, we tested them at 0, 6, and 12 weeks. So we can see that Jobelyn has a very good antioxidant property, has a very good anti-inflammatory property, and hematologically, it has been seen to increase CD4 count in patients that were suffering from HIV, and We also know that it has helped to reduce crises in patients that were seen as in sickle cell clinics. These are some of the drugs that are seen in the international market. In the international market, like in the USA, some other adjuncts were added to Jobelyn to treat arthritis, heart diseases, and immune boosting products. So that makes Jobelyn an international drug that can be used not only in Nigeria, but the world over. And this Jobelyn will actually open up avenues for people to think more of how to look at our herbal products, and for the purpose of, one, widespread acceptability between our people, and that those that are safe can be safely used. This does not mean that every herb is safe, but toxicological studies have shown Jobelyn to be very safe. Thank you very much. God bless.
This is exclusively Nigerian medicine, yes? And do you have experience using this medicine for another infection disease? For another infection, yes.
Very beautiful presentation. Considering the sample size of the study you showed us, do you think this thing can be generalized?
Thank you very much, Colonel Ayuba, for that beautiful presentation. I happen to be, my name is Dr. Abia Okon. I'm a general surgeon, and I have been involved in the research on this herbal medicine for quite a while. For example, in my hospital, I rarely talk about blood transfusion. Now, you see, it has always been strange for people to hear that word about one medicine being able to do so many things. And I can hear General Obaje comment on that. You know, that is the way we approached it in the beginning. It's not possible, it's not possible. But when we just looked at the Krebs cycle, oxidative phosphorylation, I'm sure during your school days, when you were doing biochemistry, you came across Krebs cycle, citric acid cycle, or oxidative phosphorylation. The answer is there. Because the moment oxygen mixes with glucose in the mitochondria to form adenosine triphosphate energy, then produces free radicals, which continues the oxidation. That's the problem. It is the oxidation that damages the DNA of the white blood cells that leads to chronic inflammation. So you see, once you have oxidative phosphorylation, free radicals are produced, they cause oxidation, they damage the genes in the white blood cells. The white blood cells go into chronic inflammation, which could lead to cancer. So you will agree with me that, just like the steroids do, the moment you can block the oxidation to an extent, the oxidation, which we know is a protective mechanism, the oxidation will be reduced to an extent. And this reduction of oxidation and inflammation is what makes it appear as if, in fact, such powerful substances like Jobelyn, containing a lot of flavonoids, can practically do most of the things we talk about, starting from atherosclerosis, because it contains polycosanol that reduces cholesterol. It contains substances that, like the tannins, phenolic acids. All these are powerful antioxidative, anti-inflammatory substances, which, if well harnessed, I want to believe, because if you think of it, nature made every cell in the human body to produce antioxidants. And I want to believe that there was a reason for that. And that is simply what we are doing. We are just trying to copy what nature has made into our body to get our body to have as much antioxidants as possible.